I work. So the background and the rationale for the trial is set out in the slide. Pectus is a relatively rare disease. Um, it occurs in about 1 in 1,000 people. Um, Corrective surgery for cosmetic indications is well developed and is very commonly performed and valued by patients. However, whether surgery objectively improves your physical function and your cardiopulmonary function has actually never been assessed in a randomized controlled trial. So all the evidence on which the operation is based is retrospective data. And over the last few years or so, funders in particular, but also patients and clinicians have become increasingly skeptical of the value of this major operation to correct the physical limitations of Pectus beyond cosmesis. And those of you in the UK will be aware that in 2019, the National Health Service decommissioned Pectus surgery, which means that they stopped paying for it, on the basis of lack of high quality data, which demonstrated an improvement in physical or cardiopulmonary function. And internationally, we know this is a problem because lots of HMOs and insurance companies who pay for care have similar concerns and have over time similarly restricted funding for this operation. So that's the clinical setting in which the question is based. So the trial has two main objectives. There's a health economic objective and a primary clinical objective. So we're going to set out to determine whether corrective surgery is superior to no surgery measured at 1 year in terms of your change in physical function. And the tool we're going to use to measure that is called the SF-36. Some of you might be familiar with it. I've got a slide telling you more about it later on. And we're also going to try and determine whether surgery is superior to no surgery in terms of improving your cardiopulmonary function. And we're going to use a cardiopulmonary exercise testing, which I'll call CPET going forward, to assess that also at 1 year. And because this trial was commissioned by the NHS, that the sort of health economic evaluation is also a key objective. So we're going to estimate the cost for every quality adjusted life year that is achieved with surgery. So those are the, if you like, two main objectives. Those are the primary objectives. They're two primary objectives. I can see the statisticians already rolling their eyes because trials only answer one question, but I'll tell you how we're going to answer those two questions with this trial.